Hi, my name is Dr. Akshay Nair and I'm an oculoplastic surgeon based in Mumbai, India. And I'll be talking to you today about blepharospasm and its treatment with botulinum toxin, also known as Botox. So, what is blepharospasm? Blepharospasm is a condition where patients often complain of involuntary eyelid closure. This is spontaneous, beyond their control or their will, and usually involves both the eyes. Patients find it extremely difficult to keep their eyes open for a long period of time. One can imagine how difficult it must be going through their daily routine while suddenly experiencing episodes of eyelid closure while driving or walking down the street. And therefore, it is extremely important to correctly diagnose this condition and treat it effectively. And one of the most effective treatments of this condition is a drug called botulinum toxin or Botox. This typically is injected into the eyelid muscles which are responsible for the blepharospasm. They take about a week to show their effect, and the effects last for anywhere between 3 to 4 months, after which a repeat injection is required. Here you can see in this brief video how the botulinum toxin is being injected into what we call the pretarsal orbicularis muscle, the muscle that is on the eyelid extremely close to the eyelid margin. This requires specific dosage at multiple pre-designated spots across the eyelid and the eyebrow. Notice how the patient is comfortable and the procedure is relatively pain-free. This is because the entire skin of the eyelid area has been anesthetized using a numbing cream for about 20 to 30 minutes before the procedure. The part being injected now is the orbital portion of the orbicularis oculi muscle. On an average, between 30 to 50 units of botulinum toxin or Botox are injected at every sitting. And you can see a week after the injection, the patient's symptoms have significantly improved from being completely unable to keep their eyes open on the left to being absolutely comfortable on the right. Botox is extremely effective and can be given repeatedly within intervals of 3 to 4 months over a long period of time. Now, similarly, the elderly gentleman whom we saw earlier has also responded very well to his botulinum toxin injection, where on the left you can identify the muscles that keep going into spasm and contracting, and on the right, here he is comfortably having a conversation after the treatment with botulinum toxin. So if you suffer from blepharospasm or know someone who does and can benefit from the treatment of blepharospasm, feel free to reach out and contact us to schedule an appointment.